In this lesson, I'm going to be explaining what dystocia is for you and then your role in providing care. So dystocia means it's a prolonged labor or really painful. So things just are not going as smoothly as they should. This can happen for several reasons. So a few of them are that it could be a hypotonic labor, and that means that the contractions are weak or not as effective as they should be. So they just aren't getting it together. It could be hypertonic, which means we have really strong, painful contractions. But these contractions are so strong and happening so fast that it's not able to cause dilation or effacement changes to the cervix. It could be that we have a large fetus, a macrosomic fetus. It could be their positioning. We need them lined up just right to deliver. So if they're in a poor position, then they're not able to put pressure on that cervix to cause dilation and effacement. So it could be their position. It also could be mom's pelvic structure, just her anatomy. Think about those awkward times that you've tried to move a couch through a doorway. It never goes well, right? Especially if you have it facing kind of the wrong way or turned funny. You have to get it lined up just right to get out. So this fetus is a little too much to the left or a little too much to the right and not centered. It's going to cause a problem. What do we find on assessment for these patients? So the patient might have excessive pain in a uterus that is hypertonic. That uterus is just pounding out contractions, very painful. You might see fetal distress occurring. Think about that uterus being hypertonic and contracting. It doesn't give time for the uterus to rest and refill the placenta with good nutrients. So we might see fetal distress. Uncoordinated contractions is something else that you will see on a fetal strip. So this is all happening, which is prolonging labor, and then not progressing. So we're not getting the cervical dilation because either our uterus is having hypotonic contractions or even putting out hypertonic, being hypertonic and not allowing everything to happen correctly to refill that uterus, relax, get that resting time in between, and cause the dilation and effacement. For our management of this patient, we are going to be constantly assessing for any fetal distress that we are having. If the fetus shows distress, then we want to notify the doctor immediately. We will give medications as ordered. So some of these medications will be pain medication for the contraction pain. So maybe an epidural or nitrous oxide to help take the edge off. IV fluids. So IV fluids prior to getting her epidural are needed. Tocolytics. So this is going to be for a hypertonic uterus. Then we want to give tocolytics to kind of slow those contractions down. That way we can reset and hopefully get a better pattern going. And then oxytocin or pitocin. This is going to be given in hypotonic labor to get the contractions going. We need the patient to try to rest as much as she can in between contractions so that she'll be able to focus her energy and have energy to push. Walking. So this is going to help her get into a good pattern if she walks around the unit. So this will be more for those in their hypotonic labor, just to help get contractions going. Our education is going to involve a few different things. So we might need to turn and reposition this patient a lot. So we want to educate her on this. Sometimes turning the patient into different positions can help get that baby in a better position for delivery, or help get more oxygen to the baby. Remember, our left lateral position is going to be best for mom to get more oxygen to the fetus. So doing these things to help. And then our medication options for the patient, what she can have, epidural, nitrous oxide, different things to help take the edge off. If she doesn't want to go straight for the epidural, the nitrous oxide is always a good option. So just helping the patient to know her options so she can stay involved in her care. Our nursing concepts for a patient undergoing dystocia are going to be reproduction and safety. These are our concepts because we have someone in labor with dystocia. We want to promote safety of that patient, of the mom and the baby. This can cause some unsafe situations, especially in a hypertonic uterus. So we worry about the safety of the patient. All right, let's review. So dystocia is a labor that is either prolonged or painful. So our prolonged is going to be our hypotonic. We're not contracting the way we should, so it's going to prolong labor. We have a big baby, takes longer to get out, it's going to prolong. The pelvis structure, if the baby's having to move all around trying to find its way out, it's going to prolong. The positioning of the fetus, if it's turned funny, that is going to also prolong labor. Painful. That's going to be our hypertonic labor. So we just have contraction after contraction, and there's no good rest time in between, which is what we need. Think about this as a horrible Charlie horse that you get usually in your calf. That is what is happening in their abdomen, that just constant tightening of the muscle. We need a good, strong pattern, yes, but we need it to also have adequate rest time to refill that uterus, refill the placenta with good nutritive blood supply. Make sure you check out all the resources that are attached to this lesson, review the different management for different types of dystocia. Now go out and be your best selves today, and as always, happy nursing.